Welcome back to Face the Nation. I'm Margaret Brennan. We're joined now by Dr. Umair Shah, Executive Director of Harris County Public Health. He's coordinated the medical response at NRG Stadium this week, where more than 2,000 evacuees were sheltered and even had to evacuate his own house. Doctor, are you back home yet?
Yes, my family came home 2 days ago. It was a pretty harrowing experience for all of us. And it just underscores that this hasn't just impacted our community, it's impacted even our responders.
What is the feeling there on the ground? Do you have a sense that you have moved into the recovery phase?
Yeah, there are still some places where some streets that are having some flooding that has continued to have some impact on the recovery side. So that is, I don't want to say we've completely gotten out that immediate phase, but yeah, we're moving towards that longer term look at what does recovery mean for our community.
And you've been telling people to avoid those floodwaters. They've got everything from snakes to alligators, and now this is concern about chemical contamination. For you, what is the greatest health risk? Yeah.
Apologies, there's a truck right behind me, so I'm having a little bit of trouble hearing you. But just to let you know that, we've been talking to our community throughout this, before the storm, obviously during the storm, and even now post-storm, that flooded waters have a number of different hazards, and that includes, like you said, critters and snakes, those kinds of things, but also the real concern around down power lines, and really, our biggest concern is that these waters are not safe. They're not. There are harmful, whether substances or chemicals or bacteria, other kinds of infectious disease agents. And so when folks are being exposed to these, we are really asking them, we're imploring them to take precautions so that they are cleaning, disinfecting, and doing those things. And if they have to even throw out items that they have that have been exposed to that. That's very difficult. As you know, for example, if children have their favorite toy and that toy has now been exposed to water and you can't clean it, and we're saying throw it out, that inherently becomes a really challenging message to a child.
What are some
these
of
are the kinds of things that are really...
Yeah, what are some of those chemical contaminants that you just gestured to? I mean, there was concern about this chemical plant and some explosions there and fumes in the air. But then there's also concern that there might be chemicals in those floodwaters. What are you seeing? What contaminants are there?
Right. So the kinds of things that you have to always think about is that the floodwater is, first of all, it's got, even if it looks clear, it likely has something in there. But the real concern is that household chemicals, just very, everyday chemicals that people have in their homes have now mixed into those waters. Then you also have the challenge where you might have a mechanic shop or another, business that may have been flooded out, and they may have other more industrial type of chemicals that can go in. And so I rather than talking about the specifics, there are a lot of different chemicals that can go into the mix. And then obviously, as you've mentioned, when you have large-scale chemical activities, that really starts to become an increasing concern. So we have to really manage that, and that's why that message is just stay out of those waters or do what you need to do to clean and disinfect.
Do you feel you have all the resources you need? If you don't know the contaminants yet, do you feel like you're prepared to deal with the fallout?
We've been through a lot of emergencies before, everything from Tropical Storm Allison, that we had a large-scale flood event, as you know, Hurricane Katrina, where we had 27,000, right 12 years to the date, right behind me in the Astrodome here. Hurricane Rita response, where we had to evacuate, and then Hurricane Ike that hit us, and then storms in between. So we always use those experiences to really help us as we move forward. But the one thing that I would say is that no emergency is alike, and that this is a massive, massive, devastating emergency for our community. And on that national level, as many of the health departments across the system know, we are oftentimes the offensive line of that football team. People don't know the work that we do until something like this happens. And so I think it's really important to know that resources for capabilities are absolutely always necessary. Do we have enough? you never have enough, but we have really what we think right now to continue to manage this acute phase.
All right, Dr. Shah, thank you very much. Good luck to you. And we'll be right back with our panel.
Thank you.
So stay with us.